Good morning, everyone. Thank you for being here. My name is Daniel Blaine, and I have the honor of being on the Center's Board of Directors. And it's my honor to welcome all of you today to the Centers for the grand opening and ribbon cutting of our new behavioral health unit. I'm here on behalf of our board chair, Judge Lisa Forbes, who unfortunately, or I guess fortunately, is almost done recovering from a bout of COVID. So many of you know we're sitting here at the site of what was once the Free Clinic of Greater Cleveland, and that was an organization that was deeply dedicated to addressing mental health and behavioral health needs of our Greater Cleveland community, really for decades. And the mission of the Free Clinic now lives on through the work of the centers and strong commitment to providing access to behavioral health care through the work of a dedicated and very talented and committed team. There's a lot of talk about a mental health crisis. What I love about the centers is the action to address it, and that's what we're here today to celebrate. So to address this growing need, the centers have opened a behavioral health urgent care. We're going to have, at the end of our program, in about a half hour, a ribbon cutting, followed by, of course, snacks and beverages, so please stay for that. And now it's my pleasure to introduce our CEO, President and CEO Eric Morse, whose leadership and commitment to ensure equitable access to behavioral health in our community has brought us all here together. Thank you.
Hello, my name is Eric Morse. I'm the President and CEO of the Centers. Thank you so much for joining us today. I'd like to begin by acknowledging our funders. This wouldn't be possible without a SAMHSA grant we received from the federal government, as well as the Adams Board support that we received this year. I want to also acknowledge our elected officials or the representatives who came today. First, thank you State Senators Antonio, Yuko, Martin for coming. Would you like to come up and have a resolution here? Would you like to do a quick read of that and maybe a picture?
Okay, so always travel with the Senator posse. I know it works well for me. We are very excited. So on behalf of the Ohio Senate, we want to congratulate the centers on the opening of this amazing behavioral health urgent care center, first of its kind in the country. Groundbreaking, amazing. Much needed, and I love the fact that we are in the footprint of the Free Clinic, which I'm old enough to remember, and in its original state, by the way. And so with that, we just want to say congratulations on behalf of Move over. Photo op. Here we go. Thank you.
Thank you.
You know, I'd just like to say one thing too. I'm going to add this to your collection.
Oh, whoa, thank you.
What this means to me, I've represented the city of East Cleveland for the last 8 years. And East Cleveland is the 4th largest poor city in the entire country. And the wonderful people who call East Cleveland home deserve better. And we are right on the cusp of University Circle, which has been a shining star for Cuyahoga County for years and years and years. And I kind of like to think of this as a marriage, where we're bringing the two parties together. One where we seem to have an extremely amount of success in wealth, and those who have dreams of success in wealth. And merge them together, and it starts off with healthcare, and it starts off with mental health care. Without mental health care, and you know, I love it when the three of us up in the Ohio Senate can talk to some of our colleagues and see the look on their face like, oh, thank God I don't have mental health issues in my family. How wrong they are. We all have mental health issues in all of our families. Sometimes it's blatant, it's right in your face. Sometimes it's very subtle, and you might not pay attention to it. But the reality of it is, when we have a facility such as this, who offers help, and my favorite word, hope, to every single resident of this great state of Ohio, then we've done well. Eric, thank you and congratulations.
Thank you,
Best wishes.
Senator. Thank you. All right. I also want to recognize Mayor Bibb, Chief Medical Officer Dr. Cooper, and the Chief Education Officer Holly for joining us. And then really, really grateful that Director Lori Chris from the Department of Ohio Mental Health and Addiction Services was able to join us, and Maggie Tolbert from the Cuyahoga County Adams Board. Thank you so much for making time in your day to join us. Am I missing anyone, any other elected officials that I'm forgetting? Or who didn't take their seat up front? Okay, great. Next, I want to thank the Centers Board and the members who were able to join us today. If you could just quickly stand, just so we can recognize you. Without all you do, we wouldn't be here. Your leadership, your support, it's all invaluable to me, and I know to the rest of the team, so thank you. And lastly, but most importantly, and they're probably gonna get a couple thanks today, is the team of the Behavioral Health Urgent Care Center, who have been here for the last few months, putting this program together, working out the kinks through a soft opening where we haven't advertised at all. They've seen over 250 people already. So I'm just so grateful for the work that the team has done. And if I know two of the team members in the back, but anyone else in the room, if you could just stand up and be recognized, it'd be great. Yeah. And while unable to join in person, I want to recognize U.S. House of Representatives Congresswoman Shontel Brown, who sent us this special congressional recognition. And I will read it. On behalf of all who reside in the 11th Congressional District of Ohio, I want to congratulate the Centers. This organization for nearly 50 years has been successful in helping people to embrace healthier and more successful lives. They helped countless individuals and families fight back and overcome the effects of poverty, inadequate education, job readiness, drug addiction, physical and mental health challenges. This well-respected, not-for-profit organization has evolved over time in response to the changing needs of the community and the changes in both economic and public policy. We would like to congratulate the Centers as they open their new behavioral health urgent care facility. This is a day that should be filled with celebration. May God bless and keep you. All right, I'm going to turn it back over to Daniel, who will introduce our next speaker.
Thank you, Eric. It's now my pleasure to introduce Martin Williams, who is our Chief of Programs for Behavioral Health. But first, Dr. Vincent Karinji, who is our Chief Clinical Officer. Thank you.
Thank you, Daniel. As Daniel mentioned in his opening remarks, there is a crisis in behavioral health. The need for mental health and addiction treatment has increased dramatically since the beginning of the COVID-19 pandemic. And with overdose and suicide deaths on the rise, the stakes could not be higher. Even before the pandemic, rates of depression and anxiety were inching higher. But the grief, the trauma, the physical isolation of the last 2 years have driven Ohioans to a breaking point. Being able to access care could literally be a matter of life or death. Less than half of Americans with a mental health condition receive treatment. Last year, over 500,000 Ohioans who needed mental health care did not receive it due to lack of access, stigma, or cost. Factor in severe shortages of behavioral health providers. The end result is that many people who desperately need support are finding they have few options. For most people who are experiencing new or recurring behavioral health symptoms, access to care may look like this: making numerous phone calls, most of which go to voicemail, waiting for a callback, only to learn when you do get a callback that they can't see a provider for 30, sometimes up to 90 days. And yet we know when someone has finally suffered enough to overcome stigma and shame associated with asking for help, they have already delayed care by months and sometimes years. As a system, we have to do better. It is imperative that we promote better pathways to care and make it as easy as possible for all Americans with behavioral health needs to access the resources that will improve their well-being. When demand is high and resources are scarce, it becomes our responsibility to reimagine sustainable mental health care. Leaders like Director Chris of Ohio Mass, as well as Scott Osicki, Maggie Tolbert, and all the leadership team at the Adams Board know this, and they are taking meaningful action to address the crisis alongside a dedicated system of providers. These behavioral health urgent care centers fill a dire gap in the current continuum of care by providing effective recovery-focused services in a respectful and accessible environment. The centers aims to reduce or eliminate avoidable emergency department visits, law enforcement encounters, or use of emergency responders. These centers are a milestone in our ongoing efforts to bring parity to mental health awareness, accessibility, treatment, and destigmatization. And by removing barriers for individuals needing support, we hope to see tremendous mental health benefits for many residents throughout Northeast Ohio. Thank you all for joining us today.
And now, without further ado,
Good morning, everyone. So where are our behavioral health urgent cares located? They're in 2 locations. The first one, of course, here is at our Uptown location. The other one is at our Gordon Square office. Each center is staffed with a multidisciplinary team that consists of psychiatric providers, counselors, nurses, and care coordinators. These dedicated team members work together to assess the current needs of each individual and provide same-day services. Services are available across the lifespan and may include psychiatric evaluations, brief solution-focused therapy, care coordination, healthcare screening, medication, and much, much more. For those clients needing medication, there are on-site pharmacies at both locations so that individuals can walk out with medications in their hand, which is really rare. Individuals are provided with appointment schedules before they leave, not a list of phone numbers that they can get to link to services, to an ongoing provider here at the centers or anywhere else in the community the person chooses. Our team members continue to stay engaged with individuals until they are linked to ongoing services. These behavioral health centers are open to the public. We accept all insurances and offer a sliding fee scale so that it's affordable no matter what insurance or income situation you have. Currently, the hours of operations for our centers are Monday through Friday, 8:30 to 5. We will adjust our hours and days in the future if and as needed. Anyone can walk into our facilities during those hours, or they can call 216-325-WELLS to arrange a time. Now, I want to talk about the soft opening that Eric referenced earlier. We had a soft opening in February of this year, and I want to talk about the impact. We developed 12 referral pathways with community providers to ensure we had an efficient and effective workflow that allowed clients to get access to services the same day. As of today, as Eric stated, we've served over 250 clients. We're projected to serve another 100 clients just this month. In 5 months, we've served 250. In the month of June and July, we're going to serve 100 clients. And we expect that number to actually increase. This speaks to the need for these services in our community. So we are excited about bringing the behavioral health urgent cares to our community, and we look forward to partnering with our community providers to fill that much needed gap in our continuum of care system. Before I pass this back to Dan, I want to acknowledge the hard work of our behavioral health urgent care team and our leaders for bringing this wonderful idea that we had talked about to bringing this to our community. This is something that we've talked about for a while now, and for it to actually be here is so exciting. So I want to thank you guys for actually pushing this and helping develop this and working together to make sure we had a system to make sure people have access to services quickly. Our team members have worked tirelessly to ensure that people have access to same-day quality behavioral health care. And your dedication and passion for serving the people in our community has not gone unnoticed. You are truly appreciated. So thank you for your service.
You know, there's a lot of talk about how the centers provides accessibility to care. I actually had a earlier appointment today at Gordon Square for a follow-up to my physical. And I have great insurance. I could go anywhere. I choose to go to the centers because of the quality of care. So, and that's a tribute to the people who work here day in and day out tirelessly on behalf of our community. Yeah, good stuff. I would now like to introduce Maggie Tolbert, the Assistant Chief Clinical Officer for the Adams Board of Cuyahoga County. Ms. Tolbert.
Thank you. Good morning, everyone. I am so honored, and it's such a great pleasure to be here today. I am the Assistant Chief Clinical Officer at the Adams Board. I'm here on behalf of Scott Osicki, who was not able to attend. He is our CEO. On behalf of him, our staff, as well as our Board of Directors, Mr. Erskine Kincaid is one of our Board of Directors are here. I am so excited about this. I can remember when Eric and Martin met with us. This has been a dream of the Adams Board to have a behavioral health center that would meet the needs, offer accessibility with the goal 24/7, because what we know, you cannot schedule crisis. And our clients are just as deserving, our population is just as deserving as everyone else and should have this level of care. So again, I thank you all. I thank the staff. We are so honored and appreciative, and anything that we can do to continue to help our partnership and with this collaboration be great. Thank you.
I would now like to call upon Lori Chris, who is Director of the Ohio Department of Mental Health and Addiction Services. Lori, thank you for joining us.
Good morning, everyone. Thank you so much for including us in this wonderful day. It is truly a celebration of opportunity and hope here in the Cleveland area. I am the Director of the Department of Mental Health and Addiction Services for Governor DeWine, and he has really, I'm not sure of the right word, he's really called into common conversation the fact that the mental health needs of Americans, of Ohioans, have not been given the time and attention that they deserve. And it's not that the system is broken. There are marvelous places like the centers that are meeting the needs of Ohioans every single day, but the system was never fully built. It was never invested in. And so we're so grateful to our partners in the General Assembly who are partnering here to invest in opportunities and to create really meaningful services and supports for citizens across the state of Ohio. When we look at why people don't get care, it's often because of stigma, that they're embarrassed, they're ashamed, and they're afraid of the consequences of admitting that they have a substance use disorder or a mental health condition. It's often because it's a kind of an invisible system. They don't know where to get help. They are afraid that if they ask for help, their control might be lost over their lives, right? They might have an involuntary commitment or a pink slip or have some services that they're not choosing forced upon them. And they're not sure how to pay for it. And what you've created here in partnership with the board is taking away those barriers. People can walk in, can ask for help, to know that it's okay to ask for help, and to not feel like they're committed to a long-term program, but to just be heard, be seen, be believed, and then to chart that course for recovery that is, really of their driving in partnership with the experts that are here. And that's what we're building out across the state, but you're doing it first, right? And so we have this example to look to. We're so grateful for that. And we'll continue to partner with you and the board to learn from the successes here and to learn from the opportunities to make improvements and to grow this throughout the state of Ohio. So congratulations, thank you, and looking forward to more good news out of Northeast Ohio. Thank you.
Thank you. Senator Antonio, would you like to share a few thoughts?
So as I said before, it's always wonderful to be in this space. I've been here quite a bit over the years that I've served in many capacities, and as well as being in the legislature. It's wonderful to come to a place to see such innovation for mental health services, especially in behavioral health, when, as has been said already, we talk about it a lot. It's in the news a lot. There's always this conversation, but actually being able to see it activated and an action step, an innovative action step, is amazing. I also serve as a co-chair of the Mental Health Caucus, which is a bicameral, bipartisan committee that we have. The caucuses, I've been on the caucus since I was in the House, so many years, and we are always looking for ways to share what's happening around the state, because the legislators on that caucus come from all over the state. And so I'm very excited to go back and for us to talk about this, serving as a model, and where else can this be replicated in the state as we go forward, but knowing that in the footprint of the free clinic and all that has meant to people over so many years, and the centers, as the centers has been in this space, I'm very excited to see this next step of serving with behavioral health, this wonderful idea to have it be available for folks to walk in and access. It's going to make a difference in a lot of people's lives and families as well. So thank you.
Senator Yuko, additional thoughts?
Thank you, thank you. You know, one thing that I found amazing is you have so many illnesses that are associated with a certain age group. Unlike mental health, you can be extremely young, you can be extremely old. You know, I think back to days when I was in grade school in the 50s, early 50s, we always had crazy little Johnny in the classroom who ran around. He was disruptive, he was cute, he was funny, he was the teacher's nightmare, and he suffered from autism. But you know what? We didn't talk about autism back in 1950. We have your senior citizen who goes walking down the street one night, and all of a sudden he's looking in someone's living room window with his hands pressed to the glass, and someone's calling the police saying, I think we have a peeping Tom in our house. No, we have somebody with Alzheimer's who went for a walk and got lost, and he's looking for a house that's familiar, so he thinks it might be his, he might be able to go into it. We have people who go to work and wonder why they keep getting passed over for a promotion or a raise when their coworkers keep getting those. And it's because, you know what, he's a little bit different than everybody else. In here, he's the same person, but somewhere in here, there's a discombobulation that causes him to act a little bit differently. And we need to reach out and make sure that, you know what, we put him back together and keep him whole. So I sat here and I've looked at this, our vision, health. Number one, that's our number one asset, folks, because without health, we have nothing. When I see family, when I think about what this is all about, I see all of you, and I can't help but think all of you are thinking about family members and the fact that, you know what, mental health issues, they don't strike people who are just poor or black or white or Hispanic or filthy rich or whatever. It can affect anybody at any given time. And we all have to work together to make sure that we continue to do better. The next word is work, because we all have to work, because we all have to eat, we have to have a place to live, so forth and so on. And then, as I stated before, my favorite word is hope, that this gives us hope for everybody in the great state of Ohio, in the Cuyahoga County, and our various communities will be directly impacted by this facility. So to all of you that are involved in this facility, thank you from the bottom of my heart. Thank you for what you've done. Thank you for what you will continue to do, and God bless you. Thank you.
And I'd like to do a special thanks to the 3 state senators and the officials from our various partners who are here today. We really can't do it without you, and we greatly appreciate your support, so thank you. And now, hitting cleanup, our talented CEO, Eric Morse.
Well, before we begin the ribbon cutting, I just want to thank everyone for your commitment to improving behavioral health access. The need's huge, and it's urgent. but the Centers is positioned and committed to take bold steps to innovate along with our community partners and elected officials to meet these needs with urgency. Community health infrastructure. You're here at our nicest facility. Our other 4 are in desperate need of help. We have this once-in-a-lifetime opportunity with the combined billions of federal ARPA funds that have come into the city, county, and state to provide a once-in-a-lifetime opportunity to make significant one-time investments in behavioral health that have not seen investment, significant investment, in decades. We have big plans that we have been in communication with many of you already about securing ARPA funds. We can leverage on our own millions of additional dollars if we receive these funds. And we are eligible if we do this, we can upgrade our facilities. We can double the number of clinicians we have and double the number of people that we serve, in addition to providing new, innovative, and specialized services that are not available in the community today. Now, it is time for the ribbon cutting. Once the ribbon cutting is done, you'll be able to take a tour of the actual place where the services will take place. You're welcome to grab some food and some drink and for us to have kind of additional fellowship after that. So I'd like to invite all of our dignitaries over. We have the big pair of scissors, which is like, when I became CEO, I was like, do I get the big scissors?